All right, I'm delighted to say that we have Secretary Carson here. So, Mr. Secretary, on behalf of the Council of Large Public Housing Authorities, CLPHA, we are absolutely delighted to have you back. You speak today to a room that is full not only of housers, but also of educators and healthcare professionals. This is our fourth national convening that looks at the connections between housing, education, and now this year, health outcomes. Each year, our audience has grown larger, and it's become more and more apparent how vital these connections are. In this time of divisiveness, particularly here in Washington, D.C., our theme today is one that we believe you share and care passionately about. We believe that partnerships between these diverse worlds is a critical and remarkably effective strategy for achieving our bottom line outcomes. Healthy children, students entering school ready to learn, and the workforce ready to earn, families becoming self-sufficient, and senior and disabled households living in dignity. In communities across the country, schools and housing authorities and healthcare systems are increasingly partnering around these goals. Data is being shared, outcomes evaluated, best practices documented. We invite you out to observe these benefits and these efforts firsthand. Your leadership here in D.C. is critical to our work. We know you've walked the walk in inner Baltimore. We have a long personal track record in both health and educational innovations. Your foundation, the Carson Scholar Fund, the 180 Carson reading rooms scattered across 23 states with literacy programs. These are tremendous efforts that we deeply admire and encouraged by. We're eager to hear your vision of how the federal government can support our efforts and take the progress that we are making to the next level. Many of the housers in the room just came out of a two-day convening of the 39 Moving to Work housing authorities. And I have to say that after 2 days of sharing stories about what is going on in these kind of partnerships at the local level, I come out increasingly convinced of how effective deregulation and flexibility on the local level is, how critical that is to success, and the creativity that we can unleash on the local level with a little less regulation from Washington, D.C. So our thanks for your time today. The public housing industry very much looks forward to a continuing and strengthening partnership in serving our community's most vulnerable residents. So please join me, everyone, in welcoming Secretary Carson.
Well, thank you for that wonderful Steve Norman type of introduction. And I just want to recognize the foundations that have been so helpful in sponsoring this event, the Kresge Foundation, Robert Wood Johnson, MacArthur, and the Bill and Melinda Gates Foundation. And I also want to thank all of you for your support of Hunter Kurtz, who's the President's nominee for Assistant Secretary of Public and Indian Housing. He's been waiting a long time, like so many others. And I'm really looking forward to a day in Washington, D.C., where we don't allow politics to get in the way of governing. CLPHA has once again taken the lead in bringing hundreds of participants from the public and private sector together with the common goal of improving life outcomes for low-income people, and especially for children, which hold a very special place in my heart. Now, we can all surely agree that the challenges we face in public housing spaces require a more robust and innovative approach, that we cannot simply sit still and remain as rigid as those ancient Chinese terracotta warriors downstairs. I have recently been on the road for a number of days talking to families at opioid drug rehabilitation centers, visiting RAD demonstration projects, and a host of other projects. One common takeaway that I've seen in my travels is that the families and communities that we serve all over this nation really want to break out of the cycle of poverty that keeps them bound to dependency. As some of you may have heard me say before, at HUD, we define success not by the amount of money in a program or the number of people that are in a program, but rather the number of people who graduate from these programs with positive economic outcomes. It may seem hard to believe, but we are amid a major transformation in the way we tackle these challenges. It will take time, and it will not be easy, but in the end, we will reinvigorate HUD, both in its mission and programs. And I want all of you in the audience to be a part of this positive change. And as far as the mission is concerned, a lot of you have heard a lot in the creative news media about our mission statement. Our mission statement is in the process of being crafted. It's a three-part adventure. Number one, the top leadership considered various statements. Number two, a much broader segment would look at it. And number three, we would get opinions, which is the first time that's ever happened, from the entire organization, including regional offices. So it's a multi-month process, nowhere near completion. But it is very important, obviously, that we make it clear that we now are targeting people as opposed to programs. And we want to get people out of poverty. And of course, in no way are we backing away from any of the facets of the Fair Housing Act. Now, if anybody knew me, they would know how silly that allegation is. We know that the current model of public housing is unsustainable in both dollars and common sense. That's why we're working with public housing authorities to convert public housing assistance to vouchers. We're looking at voluntary conversions of our nation's housing stock so assisted families and others can have more independence. And we're spurring greater economic opportunity by connecting public housing residents to jobs, job training, education, and health care, among other services, through our Envision Centers initiative. I know that some of you in this audience are already engaged with the centers, and we hope to make the advantages of the initiative clear to everyone. Finally, we are modernizing and streamlining existing rental assistance programs. Federal interagency partnerships, data sharing, childhood health and education are all near and dear to my heart. But I want to center my remarks on rent reform, as that will help transform all we do by opening new paths to independence and access to quality and affordable housing to all of our tenants. Now, as you no doubt have heard, we've recently proposed a set of rent reforms to improve the way we assist the more than 4.5 million families we serve. And every year, the cost involved in our rental assistance programs continues to grow in budgets, ineffectiveness, and complexity. The rent structure, in fact, hasn't been addressed in decades and must reflect the realities of today's demand for affordable housing and for our residents to graduate out of public housing into self-sufficiency. This is a necessary conversion and one that is way overdue. And it's time we really start focusing on our people. We only have 330 million people. China and India have 4 times that many people, which means we have to develop all of our people. We can't leave any group of people in our society undeveloped. It's time to bring all parties to the table and further drive the dialogue regarding how we can best house, assist, and ultimately move families out of dependency. There are many positive innovative and responsive ideas being floated around this town on this issue. I know that Congressman Dennis Ross from Florida will soon be introducing his legislation to further the debate. It's no secret to anyone in this audience that the current rental system is counterproductive. Especially troubling are the unintended consequences of the way we now calculate the level of assistance, how it can hold back the very people we're supposed to be helping, dissuading families from earning more income, reaching self-sufficiency, and even marriage. The current rent system, combined with other welfare policies, discourages the inclusion of family members with incomes. Husbands and fathers are not encouraged to live together or fully participate in their families' lives, all because this would lead to sharp increases in rent. Not only is the current system unfair to the tenants in public housing, but to everyone involved. Unfortunately, it's a lose-lose proposition. There are some who live quite comfortably themselves and are quite content to leave others in a state of dependency on them. We all know how dense and complicated the system is. PHAs, owners, and residents must monitor and record more than 40 different sources of income, from figuring out future incomes to recording detailed medical, child, and other mandated information. It's a perfect storm of paperwork that is incredibly burdensome and often creates confusion along with errors. Now let me pose these questions. Is there a tenant, housing authority, or policymaker who hasn't been perplexed or can make perfect sense out of a rental system that we've had in place for decades? A recent HUD study found that each year nearly 25% of rents charged to HUD assistant families are miscalculated, resulting in $750 million of improper rent payments. In anyone's book of business, this is a real problem. Now let me mention several details of our Making Affordable Housing Work Act. First, we're proposing a new simplified core rent structure that is far easier for both landlords and tenants to understand, and one that would translate into real savings and less paperwork and more income for tenants. As many of you are aware, the current system, with its many deductions and exemptions, can have similarly situated tenants paying vastly different rents for identical housing. It's simply not fair. What is especially unique in our proposal is that housing authorities and owners would now only be required to verify income every 3 years rather than annually. While this would ease the administrative burden for all concerned, as tenants are required to surrender vast amounts of personal information each year, it would encourage residents to increase their earned income. No longer would a minimum wage hike or an extra job negatively impact annual household rent for 3 full years. No one is well served by today's highly confusing rent rules, particularly tenants who are taxed each year when they earn more income in the form of higher rents. Any way that you look at it, the proposal provides a new incentive to earn and to save. Second, we're proposing to create a menu of choice rents that housing authorities and owners may implement, as well as allowing them to develop their own rent structures, all to promote greater flexibility and especially local control. We have learned from our Moving to Work demonstration program that alternative rent structures may indeed work better in some communities. I'm talking about stepped and tiered rent structures or family self-sufficiency escrow programs, all of which help drive tenant self-sufficiency. On a regular basis, we work and talk with local partners, both PHAs and property owners, who have very good ideas on how to best encourage residents on the road to independence. So rather than force all residents into one-size-fits-all systems, We will offer choices and grant waivers to allow innovation and experimentation. Third, our proposal will help ensure fiscal sustainability. To assist just the same number of households, we are continuously having to go to Capitol Hill and ask Congress for budget increases. If we seriously want to ensure adequate housing assistance for the next generation, and today only 1 in 4 families who qualify for HUD assistance receive it, we must transform how we have been structuring our rental assistance programs. Clearly, business as usual and decades of old rent formulas will not get us where we ultimately need to go. We must provide meaningful, dignified assistance to those we serve without hurting them at the same time. And let me add that rent reforms will not increase rents paid by elderly and disabled households we serve. In closing, please remember that this is only the first step in the road to reform. It is a proposal that is intended to start a very necessary conversation about reforms of the current rental structure. In the coming weeks and months, we will be working with all of our stakeholders, our HUD-assisted families, and Congress to further this conversation about housing assistance. Whatever the final legislation, this much is certain. The current system is not working for the best interests of millions of families and communities. Remaining frozen in time like those big statues downstairs really is not an option. I look forward to working with all of you on the front lines of assisting our country's more vulnerable families. And I do realize that the work you do sometimes seems thankless, and you ask yourself why you're doing it. But do recognize that it is absolutely essential to the development of a critical part of our population. Thank you again for the invitation to join you, and I look forward to working with you. Please have a great summit.
So the Secretary has a limited period of time for a few questions. In the interest of efficiency, I think we have those lined up. Jeff Patterson?
Yeah. Good morning, Secretary.
Hi.
Good morning. Jeff Patterson from the Cuyahoga Metropolitan Housing Authority in Cleveland. What leadership role do you see HUD playing in improving education and health outcomes?
Well, I'm glad you asked that question because those are areas that I'm particularly interested in. I'm fond of saying that regardless of a person's socioeconomic background, they get a good education, they basically write their own ticket. And that is absolutely crucial in all the policies that we design, that we keep education and training at the forefront. And as far as health is concerned, I spent obviously a large portion of my career, taking care of children. Sometimes operating all night to try to save them, give them a second chance at life, just to be faced with having to send them into a horrible environment with rats and roaches and bed bugs and mold and lead. And that was extremely disturbing to me. And now I'm blessed with an opportunity to actually do something about that. And it's going to be a key to what we do. Our Office of Lead Hazard Control and Healthy Homes is becoming extremely active, and not only providing technical assistance around the country, but also in making grants to people in particular who have had success, who have shown that they know what they're doing, and who have been able to leverage the public dollars with the private doctors to get more bang for the buck. We also are working on an initiative with churches to adopt a block, and a specific church be responsible for the lead remediation in that whole neighborhood. And people, when they can actually focus on a project themselves, frequently tend to get very energized. I was less than 2 weeks ago in Houston in a Hispanic community, where everybody had come out. There was a whole army of people engaged in lead abatement. And This was sponsored by Lowe's. In other places, sponsored by Sherwin-Williams and many others. You know, what I'm really encouraged about is around this country there are so many good people, people with big hearts who are willing to help. And as long as we can forget about all this divisiveness and people who are trying to drive wedges, every demographic, race, income, religion, age, gender, you name it, that's your enemy, hate them. You know, that never works. It has never worked for any society, and it certainly won't work for us. A house divided against itself cannot stand. But when people begin to look at the innate goodness and the willingness to help your fellow man, there is an amazing amount that we can do, and we're very anxious to work with all of you to continue those things.
Thank you.
Catherine?
Good morning. I'm the Executive Director with the Santa Clara County Housing Authority in California. Given that the focus of our summit is on different sectors of the community partnering at the local level, what can HUD do to support these current efforts?
Well, you know, partnering is absolutely crucial. You know, we partner with HHS, DLG, particularly on the opioid epidemic that's going on now, with the Department of Education, on some of the child care initiatives that are so critical, particularly, you know, in a lot of our public housing and multifamily housing. We have a lot of households that are headed up by young women. And in many cases, their education has stopped at the time of that first pregnancy. And you know, we want to provide them with an opportunity to have the kind of child care that they can have faith in, that will help develop their children while giving them an opportunity to get their GED or their associate's degree or their bachelor's degree or whatever degree, and become independent, and more importantly, teach that to their children to break those cycles of poverty. These are the kinds of things that we can do when we're willing to work together, work across the silos. And believe me, it's easier said than done. Everybody believes that the silos should be broken down except for their silo. That's generally the way that it works. And everybody wants their little fiefdom. But you know, what we have to recognize is that we're all working together for the good of the people. And the government works for the people. The people don't work for the government. Somehow that's been forgotten. And I think as we continue this progress that we're having by working across the silos, we will make a tremendous amount of progress.
I think we have time for one more question. Andrew?
Mr. Secretary, thank you for joining us and appreciate your remarks. Andrew Lawson from the Seattle Housing Authority. And a little bit of a follow-up on that question. As this gathering is a gathering of how to use housing as a platform to connect with education and connect with health. And one of the big issues around that is data. And how we can share data. And I was wondering if you could speak a little bit about how
Yes.
HUD is sharing data with other institutions, other federal agencies within the federal government, and your perspective on, in the future, how that might be expanded.
Well, thank you for bringing that up. It's such an important issue, the sharing of data and making decisions based on data, based on evidence, and not on ideology. Because, you know, what we've been doing is lurching from left to right, depending on the election, and not making forward progress. And I think a lot of that happens when people make policies based on ideology and not on data. So we've been working very closely with all the other federal agencies for that purpose, just to emphasize the data fact. If you go back to the turn of the century before this last one, the average age of death in this country was under 50. And at this last turn of the century in 2000, it was approaching 80. That's a dramatic change. And how did that happen? It wasn't because of some great new genetic discovery. It was because of data. The medical profession began to make policy based on evidence. And that's what changed things in medicine, and that can change things in government as well. And through our Envision Center initiative, We have already gotten commitments from 21 federal agencies and 20 sub-agencies to work together, and it's been amazing as we discover what is available. And some of the departments where you wouldn't even think that they had something that would benefit people in the public housing sector, and they do. But these things need to be coordinated. And the whole concept is bringing the federal things, all the things that we have at HUD, all the things we have at all other federal agencies, the state agencies, the cities, the municipalities, the nonprofits, the faith-based organizations, bring that under one roof, coordinate that, and put it in juxtaposition to the need. Because people who need these things, I don't think Einstein could work his way through all of these various programs, but by bringing them together and coordinating them, we provide a lot more assistance in terms of getting people out of poverty. And who does that really help? It helps the entire society. We begin to train people with skilled jobs. There are 6.5 million skilled jobs in this country that are vacant right now. And by emphasizing Section 3, look what begins to happen. We begin to get these people trained. Section 3 has been on the books for 50 years, but people have found ways to skirt around it. Our OGC is now putting teeth into Section 3, and we're incentivizing people to use that program to get people trained. And it's not just a matter of building more affordable housing, but it's a matter of moving people through and making room for others. And I think when we begin to think that way, we stop the bickering and we recognize that this is going to benefit our entire society. So thank you for what you do. I know it seems thankless, but it is crucial to the success of our society.
Thank you, Mr. Secretary.